Healthcare, malpractice, and other myths. Welcome to Sound the Dorms. My name is Kenneth Murator. According to an article published in the Journal of American Medical Associations, JAMA, over 250,000 people die each year due to medical malpractice, and nearly half of these are from emergency room errors. Medical malpractice has become the third leading cause of death in the United States after deaths from heart disease and cancer. Medical malpractice is no myth. The JAMA article also broke down the following medical malpractice statistics: 12,000 deaths a year from unnecessary surgery, 7,000 deaths a year from medication errors in hospitals, 20,000 deaths a year from other errors in hospitals, 80,000 deaths a year from infections in hospitals, 106,000 deaths a year from non-error adverse effects of medication. Now, of course, there are medical malpractice issues occurring, and each and every one of those has a devastating effect not only on the individual, but those who surround that individual in their life sphere. You know, there was a 2006 follow-up to a 1999 Institute of Medicine study which found that medication errors are among the most common medical mistakes, harming at least 1.5 million people every year. According to the study, 400,000 of those were preventable drug-related injuries occurring in hospitals. So of the 1.5 million, 400,000 were occurring in hospitals. 800,000 were occurring in long-term care settings, and roughly 530,000 among Medicare recipients in outpatient clinics. The report states that these are likely to be conservative estimates. So there's no doubt that medical malpractice is occurring. And every time it does occur, it's a tragedy. And yet, what is the myth? The myth is the occurrences of malpractice to the rising costs of healthcare. When individuals hear those numbers, well, they are large numbers, especially if it happened to you or someone you know. It's devastating. But it's not the cause of the skyrocketing costs in healthcare. I mean, when we break the numbers down, we see that there were 400,000 medication malpractice injuries occurring in hospitals. There were 225,000 errors related to malpractice deaths. That means there were 625,000 malpractice cases occurring in hospitals each year. There are also 40 million individuals who are hospitalized each year. That means there was 1.56% of that 40 million which ended up being malpractice cases. In other words, hospitals were performing at a 98.44% efficiency rate with regards to malpractice. Is it perfect? No. Could it be better? Yes. Should it be improved? Yes. But that, as we can see, is a small percentage in light of the total cases hospitals are dealing with year over year. Now, every time a malpractice incident occurs, it affects somebody personally. Should they be compensated? Yes. Should it be made right to the best of everybody's ability that's involved in that process? Yes. But to say that that is the contributing factor to the rising costs in healthcare is just a diversion. It's just simply not true. What are some of the other myths? Well, administration costs. Many people point, that the administration costs in the hospitals are tremendously high. Well, the fact is, there's $400 billion in administration costs spent each year. Is that high? You bet it is. So what's the myth? Well, the myth is that 30 to 50% of that is burr related. That is billing and insurance related. For you to understand that, you'd have to understand the billing process with insurance companies. If you have ever tried to collect funds from insurance, you can then understand the skyrocketing cost for hospitals with relation to their administration. So it's not that the administration isn't high, because it is, but the myth is that that is the cause for the skyrocketing costs in healthcare. No. The cause are the coverage-based institutions which are driving up the administration costs in the hospital. And then there's some other myths too, like we would think, in fact, when we looked at the total amount of equipment being spent for hospitals, I mean, it's a $53 billion industry. Well, anybody can divide that by the number of hospitals in the U.S., and we can see that clearly we can't reduce the prices until we look at the numbers. Then we learn that 45% of that are for surgical supplies. Well, that means that $23.8 billion are being used in surgical supplies. Those are the reusables of the hospital. You know, the disposable syringe and the Band-Aids and the ACE bandages and the equipment that is tossed away. You know, is that reasonable? I don't know. But the myth is that 40% of it is being spent on equipment. $21.2 billion a year. You look at the statistics of the chart showing medical equipment going up every year. Common sense dictates that an MRI machine may cost $4 million, but you don't buy one every year. You see, you don't buy a heart-lung machine every year. You don't buy a defibrillator every year. You wouldn't even spend money like that in your own house. You see, you buy a car once every 5 years. You know, some of us even less frequently than that. Why? Because you can't afford it. But the insurance coverage-based institutions put a huge pool of money that enables the products to be purchased, because then it's just distributed out amongst everybody who's participating in that pool, whether you like it or not. Now, somebody else made a statement on this. And this is a quote from them. They said, I took on the conventional wisdom that an aging population is driving U.S. hospital bills higher. The truth is that a combination of spending on new construction and high-tech equipment pushed the nation's hospital bill to $648 billion in 2006, up 7% from 2005. The uptick was part of a trend. Since 2000, outlays for hospital care have climbed anywhere from 5.2% in 2000 to 8% in 2003 each and every year. As a result, by 2006, spending on hospitals represented nearly one-third of the $2.1 trillion we shelled out for health care that year. This was stated by Maggie Mayer in the blog HealthBeat. So the myth is, when you look at the numbers from an industry perspective, well, we're spending $53 billion in medical equipment. There it is. No, there it isn't. The point is, it's mismanagement because of a health coverage-based institution system that is operating. It's a perverted socialistic ideology in which money is being sequestered from the participants and being spent, I'll use the word lavishly, on things that we could probably do without, and we would have done without had we not had these coverage-based institutions. And what ends up happening is you end up pushing people out of the sphere of being able to afford medical coverage outside of these institutional coverage-based programs that are being run, which we call health insurance. The costs have gone up so high, it's very difficult for an individual earning an average wage to be able to afford health coverage outside of an institution, but then the actual cost of participating in the institution continues to increase and grow because of misappropriated funds. What you end up having is an insurance bubble, just like you had a tech bubble, just like you had a housing bubble, just like you had a dollar bubble, all right? And every bubble has to burst. It's not that insurance couldn't work. It's just that three-little-letter word called sin. It's the same reason why the Founding Fathers created a constitutional republic and they separated the powers, protecting us from us. You have to understand. Take Coca-Cola, for instance. Over in Africa, Africans, they buy 36 billion bottles of Coke a year. Why? Because the price is set low, around 20 to 30 American cents. Why doesn't Coca-Cola charge us 20 to 30 American cents? Because they can charge more because the money is there. As we continue dismantling some of the myths surrounding healthcare, we're going to talk about the grandma myth. Now, I'm not sure if they want to kill grandma with death panels, but it sure seems like they do want to bleed her dry. Now, we're talking about baby boomers, and the biggest year of the boom was 1957, when 4.3 million boomers were born. For the 5-year period between 1956 and 1960, inclusive, 21.2 million boomers were born, nearly 1.5 times the number born between 1941 and 1945, and the largest for any 5-year period in the 20th century. Now, why is that significant? Because it's these individuals who were born in this time frame which will begin to reach age 65 around 2017 and 2023. And we know statistically that 65 and plus are the ones who consume the majority of healthcare costs, right? So the government, by sequestering everybody's wealth into a giant pool, thereby will be able to continue to pay these big pharmaceutical companies whatever they charge. See, instead of individuals forcing these institutions to only create medications that grandma can afford individually and to only create equipment that individuals can afford to actually use the equipment, no, they charge as much as they can based on the amount of wealth in that pool that has been collected. So we need to do what is right and what is good by sequestering back our wealth to ourselves and the power of choice by not relinquishing it to the government, and telling these companies to do that which is good, charging the rich in this world to do that which is good. Every one of us is going to stand before the Lord Jesus Christ. May He give us the spirit of wisdom and revelation. God bless.